I'm soon going to be launching the Patients Getting Paid online course that will teach you how to get paid because of your illness, not despite it. Are you interested in doing patient advocacy work, but you don't know where to start? Want to learn about how to find online remote gigs or learn to create your own? I wish somebody would have created this roadmap for me. I spent a lot of time and energy and money figuring it all out. I want you to be able to leapfrog over all that stuff and get to the good stuff, getting paid for sharing your story. In my new course, Patients Getting Paid, I'll be sharing my experience and my resources on how to create an income online that lets me take good care of myself. Want to learn how I did it? Want a list of resources, places to look for online gigs, and templated emails with what to say? It's in there. Want to hear about tons of different ways you can actually build a business while taking better care of yourself? It's in there. Want to be included in a database of chronic illness warriors so your contact info can be shared when opportunities for your disease come my way? Then get on the waiting list for Patients Getting Paid and be the first to know when it launches. Sign up now at patientsgettingpaid.com/list. Welcome to the FUMS Now podcast show, where you'll gain information, inspiration, and motivation for living your best life with multiple sclerosis. Find us online at FUMSnow.com. I'm your host, Kathy Reagan Young. Hey everybody, thanks so much for hanging out with me again. I'm excited for today's conversation. It's about MS and genetics and utilizing genetics testing to further research. Today's guest is Patrick Short, co-founder and CEO of Sano Genetics, a platform that helps patients match with precision medicine research and learn more through personalized reports and other content, including patient stories. The platform is patient-centric and private by design, and through data-driven matchmaking and home genomic testing has enabled precision medicine studies in common and rare diseases, including autoimmune and neurology, MS in particular, as an area of focus. Prior to founding Sano, Patrick was a researcher at the Wellcome Sanger Institute, where he worked on large-scale genomics projects, including deciphering developmental disorders, and the 100,000 Genomes Project focused on analyzing whole genome and exome sequencing data to better understand the genetic causes of rare disease. That is a mouthful. Welcome, Patrick. Thanks so much for being here today.
Thank you, Kathy. I'm really excited to be here.
I'm excited to have you. This is so interesting. I was approached by Sano to participate in this DNA project where I received a DNA test kit, spit into the vial. I can handle that, sent it in, and I received a ton of information about myself. I wanted to do it both, for curiosity's sake, find out more about me, and because your company uses the anonymized DNA from me, a person with MS, to use for research, which is so cool. Because I've always wanted to be a part of research, but in my mind that equated to taking experimental drugs, which scares me. So this program really allowed me the opportunity to lend my MSy saliva for research, and it was super easy. And I just thought that was really cool. So I'm confident that you could do a better job in explaining the program and what each donor will learn with their own DNA tests and how that will help forward MS research.
Yeah, absolutely. I'm happy to. And thanks so much for the really wonderful introduction. In a nutshell, when we started the company about 3 years ago, so I, as you mentioned, come from a research background. So do my co-founders, Will and Charlotte. But we all have also experienced the healthcare system up close and personal in different places and have taken part in research studies. And one of the things that was really apparent to us is that taking part in research is really not very much fun for patients in general. You don't get much back. You often have no idea where you are in the project. I have sent blood and urine and other things into researchers, and I don't even know if they have ever arrived or been used for anything. So yeah, it is. And the industry, the medical research industry, really does rely on participants taking part in donating their time and MSc saliva, as you say, which I really like.
Yeah.
And we felt like there was an opportunity to do it much better. And so we started from a couple of principles. One of the primary ones being that the system is private by design and completely transparent, and participants are in control of their data. So we felt like at the time, about 3 years ago, for almost 3.5 years ago, that there was an explosion in direct to consumer genetic testing. So ancestry testing kits and number of things you can buy. And one of the big issues we saw with the industry in general is that it really wasn't clear to people that that data was actually being sold on the other side to power research. And we actually
Right.
felt like if you sat down, and we did a lot of this primary research early on, if you sat down and asked participants, would they like their data to be shared with researchers? Most people actually say yes. They just want to be in
Yeah,
control of that, understand who it's being shared with.
exactly. Happy to help forward research, but I'd like to know that that's going to be done with my stuff, my MS, saliva MS.
That's
I
right,
mean, my
exactly.
MSC saliva.
And really starting from that principle, a lot of the rest of the company sort of unfolds from there. So if we give people opportunities to take part in research, we give them the tools to have access to their own data, reports that are useful to them, and ways to take part. Then of course the researchers are on the other side, and this is what's most important to the researchers is that they have access to the data and the participants that they need to make their new medicines, whether they're precision or otherwise, a success. And actually, this is really important to researchers as well. They don't want to have the reputation of it as an industry of the treating people as guinea pigs, as is
Right,
often
right.
said. And so I think there's a really alignment on both sides. And what we're trying to do as a company is enable that through the online platform that we've built, as well as the at-home testing. And I think you explained it really well that there's a lot of different flavors of research. On the one spectrum, there's taking part in a clinical trial, which is not something that everybody wants or needs to do. For people who it is relevant, it can be really, it can be life changing in some cases. And then there's all the way on the other end of the spectrum, something as simple as filling out a survey or spitting in a tube,
Hmm.
which takes about 5 minutes.
Yep.
And MS is one of the small handful of areas where we've been focusing, and I'm happy to talk about why MS in particular. And I'm not an MS specialist. We do have scientific advisors and patient advocates that we work with who are. I am more of a genetics specialist and a generalist, but I've learned a lot about the genetics of MS through the process of working with others on our teams and the research that we've helped to power.
Yeah. Well, I definitely want to hear more about the why MS. I mean, I just think everybody should, but thank you for doing it. But I think first, let's start talking about what I think most people would have a question about first, which would be privacy. Like, how do we know that when I send you my MSC saliva, that that is who that's shared with, and that it's all kept private?
Yeah, so this is one of the first things we built from the product and platform perspective is every person who signs up and decides to take part in one of our research studies, they have full access to all their data, and they have actually a dashboard that shows the research that you've taken part in. You have a toggle where you can control whether you want it to be default private, so that any new researcher has to ask you whether they can have permission to access it, or whether you'd like to be default sharing, where you want your still anonymized data, so it's never going to have your name and email and those sorts of things included as part of the research package. So really, it's shifting the control a little bit from most of the industry, which is default.
Yeah.
You don't know default. You don't know what's happening, to default. You're in control and know what's happening.
Right.
That's our
Right.
approach to it.
Yeah, I love that. Okay, someone decides they'd like to be, part of this. They want to sign up for the DNA testing and learn a ton about their own DNA profile. I hope I'm using that term right. DNA
You're exactly
profile.
right.
Okay.
Yeah.
Okay. Um, and provide their DNA for use in this case MS research. How do they go about doing that? Like, what's the first step?
So from a purely kind of tactical perspective, they can visit our website at Sano Genetics, SANO genetics.com/MS. And we have a page that includes not just information about the genetic testing, but also curated resource like podcasts and stories from other participants that you mentioned before. So that's kind of the online real estate, and really who it's for. We're a 3-year-old company. We're an early stage company, so we're still very much in the testing and learning phases, and precision medicine is a new area. So what we're really interested in at this point are people who can help us to give feedback and improve the system and participate in research at the same time. So as a little bit of a genetics primer in MS. It was actually surprised me a lot when we started to work in the area that if you talk to patients, you'll not always, but often hear people say, "My neurologist told me that MS is not genetic." And
Yeah.
I don't know if you heard that or have
Oh, yeah.
heard others,
Repeatedly.
and it's somewhat complicated because people often mix up, is it inherited, did I get it from one of my parents directly with genetic,
Hmm.
and there's actually a lot of diseases that don't have clear inheritance, as in if your mother had it you'll have it, if your father had
Hmm.
it you'll have it, if you have it your children will have it, but there's nonetheless a genetic component. So we know that identical twins, brothers, sisters have a much higher chance of having MS if another person in their family does. And there are examples of very large families where almost everyone has MS. But in general, it's complex. So genetics is involved, and we know that it's dysregulating the immune system. There's a lot, there's a ton of different genes that are involved in the immune system, but the picture is complex. So rather than a single gene where you can say, you will or won't have it based on this gene, it's actually more like a constellation of very small effect genes that put you somewhere on a risk curve from low risk to high risk, depending on how many of these pebbles you end up with in your jar, so to speak.
Right. That's so interesting because I don't know, it was maybe more no, it definitely was intuitive because I'm not sciencey at all. My degree was in English for a very specific reason, to avoid math and science. I shouldn't admit that, but that's my truth. But I always, in my own mind, I thought, I think the cause of MS is not going to be found to be one thing. I felt like it's going to be, I always envisioned it like one of those locks where different things have to fall in place for it to lock. And I thought genetics, um, and probably environmental factors. And then I thought probably nutrition, and that might fall under environmental factors as well. But those just seem to make sense to me. And what you're saying kind of lends credence to that,
I
right?
think you're absolutely right. I think it's a wonderful metaphor. And when you look at any disease, if we step back from MS, there's kind of two. And when we write our reports, we try to break down at the beginning of the report these two axes, which is how genetic is it? Is it 100% whether you have it or not is down to genetics? And then also what are the other factors that are involved? And so that's a whole component of heritability. How genetic is it? What other environmental factors like diet or behaviors might involve. And the second piece is then how simple or complex is the genetics. So
Mm-hmm.
if we work through that kind of 4x4 square, if it's simple and it's all genetics, then that generally puts you in the realm of some very severe and often rare disorders, which is what I spent a lot of my PhD on. So in this case, if you have the gene variant, you almost certainly have the condition, and it doesn't
Mm-hmm.
matter what else you do. There's no environment
Right.
involved.
Mm-hmm.
It can also be simple genetics, but genetics plays a very small role. So one example, there's not many great examples here, but maybe eye color, for example, is genetics is not 100% of the picture. It's a large part of it, but it's not. We still actually can't perfectly predict based on your
Mm-hmm.
genetics what is your eye color going to be. It's relatively simple. There's probably not thousands of genes, but there's a handful. And then in the complex category, it can be complex where there are hundreds or thousands of genes, and genetics is everything. But there's MS, which is almost very likely in the category of complex, lots of genetics involved, but there's also a very big component which has to do with all those other aspects that you've mentioned. And a lot of the other autoimmune conditions like inflammatory bowel disease or lupus
Mm-hmm.
also fall in that category of complex genetics, but there's other things involved. So there's some kind of threshold effect going on where you need multiple of these things to line up in one way or the other. And that's a lot of the work that we're interested in helping to power with this genetics research that we enable, is to try to understand a little bit more about what's happening and why.
Wow, super interesting. You mentioned precision medicine a couple of times. Would you mind giving a little definition of that?
Definitely. I tend to use the terms personalized medicine and precision medicine pretty interchangeably. A lot of scientists and government people kind of fight about what the appropriate word is. I personally really like personalized medicine because it's super clear. Some people will say that personalized medicine is the destination where we all get a personalized medicine that's tailored for us, and maybe precision medicine somewhere in between. Of we've gone from treating MS as one group to
Masses too. Yeah, got
exactly
it.
to somewhere in
Okay.
between. And genetics is often involved, but it doesn't have to be a precision medicine. It's a little bit of a nebulous category, but really what it means is going from one size fits all to let's actually use some data to understand why this group deserves a slightly different treatment than the other group. And I mean treatment in the broadest sense of not necessarily a drug.
Yeah. Oh, love it. Okay. Thank you for that. I was really impressed. I know I've told you this, but with just like how seamless and painless this process was, I was kept incredibly well informed on the entire process. I just want to kind of go over that process for everyone's sake that's considering this. So I received an email welcoming me to the program and telling me to, expect the kit in the mail soon. So I signed up. That was the first thing. Signed up, got this email. You will, expect a kit in the mail soon. And then when I received it, it had very clear directions on how to provide the DNA sample bit. That's the MSC saliva I refer to, and how to get it, back to the company, back to you all. So once I sent that back, I received another email telling me that it had been received. So to your point, often I have done things like this before, and I don't hear that they've received it or anything. So that was good. Okay, got to where it's going. And it said I'd be hearing again as it progressed through the process, which was surprising to me, because I thought I would just hear, I heard it got there and then I'll hear it's done and here's your report. But I actually got another email saying your DNA is being sequenced, and so it was really kind of exciting. I thought it's happening. The next email said your DNA has been extracted, and then finally your personalized Sano report. So super easy and clear instruction, which is important, I think, especially for people like with MS, we can get cog fog. And I wouldn't necessarily sign up for something like I'll take into consideration how difficult is this going to be. If I'm having a bad day, I really can't go beyond a couple of instructions. A couple of steps is all I can handle. But this was super easy, and it wasn't, it was one step at a time. First this, then that. So I just want to let everybody know this is not scary in the least, and they hold your hand. So,
I'm really glad.
Okay, then I got the results back. Can you share what results are received and what they mean, what you can expect in this report?
Definitely. Well, first of all, I'm really glad that it was straightforward. We're always trying to improve it. I know it's, I'm sure it wasn't perfect. And one of the things I'm a little bit of I think we all are probably this way to some degree, prone to procrastinate on things when you're not sure how long it's going to take.
Who does that?
Who does that? Yeah. Even if, and often you'll find that it takes 5 or 10 minutes and you wish you did it long ago. But our principle here is we want to really lower the barrier for people to take part in research to make it as easy as possible, because if you're helping the researchers get their job done, then you shouldn't have to jump through hoops to do it. So that's, we're continuing to improve the process, but I'm glad that you found it easy. In terms of the results that you get back, we do really two main things. The first is we have, I think, more than 25 at this point reports based on all sorts of different genetic traits. So these are non-medical in nature, but will hopefully teach you something and explain and offer some examples of those categories that I gave earlier. So we try to predict your eye color, whether you have freckles, your hair color, your hair consistency, whether it's curly or straight, circadian rhythms, whether you're likely to be an early riser or a lark, as what they call it in England. I think, what do we call it in the US? I've lived over here for so long, I don't know.
Partier? I don't know.
Morning lark. Yeah, night owl. There we go.
Night owl.
And sometimes people kind of laugh at these because they say, I already know what color my eyes are. I don't need a genetic report to tell me. And that's absolutely true. We treat these as an educational tool to say, actually, we've never seen your eyes before, but isn't it
Right. Like it
interesting that
works.
we could, that it does work?
Yeah.
Exactly.
Right.
And
Like this is not
it's
BS. This is like, do you have blue eyes? Why, yes, I do. Do you have freckles? Yes, I do. Okay.
and
This is legit.
exactly. And it doesn't always work. Even for something like eye color, as I said, it's not perfect, but this is, as we go on, it's actually an opportunity to improve the research, because if the report is telling you that your eyes are green, but actually they're blue, then we're building functionality where you can actually say, this is correct. I am a morning lark, but this is actually not correct. I have blue eyes, not green. And trying to make that research process actually less like I'm just filling out forms that I'm endlessly tossing into the void, and actually a little bit more, you're giving something and you're getting something back. You're giving something, you're getting something back. So
Win-win.
even if exactly. So that's one big category. And we also try to make it clear through the reports what you should expect to be highly genetic, and actually most things you shouldn't. So circadian rhythm, for example, genetics plays a big role, but it's clearly not everything. Your night owlness or morning birdness is not fully predetermined. So we try to get into that nuance in the reports. And then the second piece is we go into specific diseases like MS. We have a report in ulcerative colitis as well, which are really designed not to diagnose with MS. And the reason for this is exactly what I said earlier, that MS is not really a genetically diagnosable condition. It's not going to tell you whether you have or don't have MS. And these reports are available to people who already have the condition to, again, educate and inform of what are the genes that are involved, how do they work, and really help, I guess, to bridge the gap between most of the population who have MS, who may have heard genetics isn't involved in any way, to start to, in a really personalized way, tell you, actually, there are more than 100 genes involved. And this particular report is about the 3 most well-known ones that are involved in the immune system. Here's what you carry at those positions, and here's what those genes do. So that's what that's what they are today, where we're aiming for them to be, and what we're really looking for, listeners of your podcast or others. And we have about 1,500 people, close to 2,000, I think, actually, with MS that are active on our platform today. We're getting lots and lots of feedback around how we can make these reports better going forward. And in particular, our next phase for us as a company is looping these into the healthcare system where we can. We've always, because we come from a scientific background, we have this tension between patients should have access to 100% of their data and reports, but also we're not going to be irresponsible and try to tell people that we can diagnose something that we really can't. So it's a research and educational tool, but where we can work with healthcare systems and genetic counselors and others to build something that actually really can be used in
beneficial
in a beneficial way is where we aim to be as a long term. So if anyone wants to join us on this journey and help us to shape that, then I think I mentioned the URL earlier. It's just sanogenetics.com/MS. But we'd love to have anyone who's interested get involved.
Yeah. So you mentioned the genes and like the top 3, for instance, in MS. How does that knowledge benefit us? I mean, it might satisfy our curiosity, but is that something that could be predictive, or a tool that we could use for predictability in our own children? Something like that? Is that, I mean, like, how does this benefit us beyond our curiosity?
Yeah. So the most, I think the best near-term use case of something like this is a couple things. So the first is, can we integrate these reports into the healthcare system in such a way that you can identify whether someone is at higher or lower risk in context of all these other things that you mentioned? So imagine that you were able to take you knew that you had MS in your family, because aunt, uncle, grandparent, mother, father had it, and you could fill out information about your lifestyle and environment, and you could couple that with a genetic test, and in the context of your healthcare professional, neurologist, get an indicator of are you in a higher or lower risk bin. And it certainly won't be perfect anytime soon, but it will be a great tool to enable earlier screening and detection. And this is already being done and trialed in breast cancer and cardiovascular disease, where genetics has been shown to play an important role. It's not the whole thing, but it plays an important role. So that's a big part of it. I have to be honest and say our tests today, the industry just isn't yet there to do that. So what you're doing first and foremost, if you're taking one of our tests, is helping to be part of that next generation of research that makes
helping to get it there.
happen, helping to get it there. Exactly. And the other piece is around understanding how MS does or doesn't move around in families. There's been a number of great, very large scale MS genetic studies, but there's still a lot of work to be done there, because the mystery is set of mysteries are really not yet solved, although making great progress.
Yes. And that is my goal. I think everybody's goal is for MS to one day stand for mystery solved. So here's hoping.
I love that.
You're going to help. You're going to help. Your company's helping. So I think when we first spoke, before I did this test, I said, will this tell me like if I have the BRCA gene? So just to bring it home to what I think a lot of people know about, you mentioned that breast cancer is using this type of technology. And is that an example? So you can get tested. In fact, I've just spoken with someone about getting genetically tested. My mother had breast cancer and 2 aunts. So I would know in that case, if I did test positive for this, apparently, then I have a decision to make, because I am at such a higher risk. Then I can choose to watch it more closely and maybe get more, ultrasounds done and mammograms, or choose to, have like a double mastectomy, be more aggressive in that way. Is that an example of how in the future this could potentially be used in MS?
That's exactly right. And we don't offer BRCA testing today. And the reason is really it's incredibly challenging to do from a testing perspective. And what you absolutely don't want to do is get it wrong one way or the other. So when a bona fide life-changing medical decision needs to be made, then from putting my researcher and scientist and just human hat on, you got to do that right, and
got to get it right.
And there are examples of in my opinion, direct to consumer genetic testing companies that have just gone a little bit to move fast and break things on that. There is a big problem in the industry though, which is getting that kind of testing is incredibly expensive. And I know a lot of companies are working with insurers to try to make that less expensive. But what we see as the future and the way that we want all this to go is, and I think we're actually close to the tipping point. You only need to be genetically tested once. It's quite a magical thing from that perspective, in that it's not like blood work where you need to do it every day. It doesn't change. So there will come a point in the relatively near future where the economics make sense to sequence a single time, probably early in your life. And then the bioinformaticians and data analysts can actually build really predictive scores for MS, breast cancer. Almost every common disease has a genetic component, and this is what we're focused on in enabling in the long term. But it's a long road to get there. But I think we can imagine how much different and better our healthcare system could be if we could have a genomic prevention or a predictive layer that happens much earlier on in the process. So yes, that's exactly the aim that we're shooting for, but it's a long-term one for sure.
Yeah, that's very cool. But we can all help with it. We can all help further it.
That's right. Exactly.
So you referenced this earlier, but I just want to get really clear on it. My question was going to be, how do you know what research your sample is being used for? Do you have a choice to participate in some and not all, or is it a blanket permission to be used in MS research? And you did mention you can sort of turn these things off and on, right? And you can elect for, as studies become available that could potentially use your DNA, they will ask you. Is that correct?
That's exactly right. Yep, you got it.
Okay, that's great. So what is your hope for this project long term? Where do you see this ultimately going?
Yeah, ultimately our aim as a company is to enable precision medicine, personalized medicine for everyone, everywhere. And this involves, so the typical, drug or treatment has a very long life cycle, 15, 20 years, and we need that to compress and get much faster. And we also need to embrace new forms of early detection and prevention that are not a drug in any sense. They're actually just an early warning sign or a flag that you are at a higher risk of MS, and this person over here is at a higher risk of cardiovascular disease. I actually am almost certain it will come to be that all of us will be in the high risk category of at least one common complex disease. If it's not early heart attack, then it's breast
Right.
cancer. If it's not breast
Right.
cancer, and that's maybe it's a little bit shocking to say it that way, but I think most of us, if we look at our extended family, we all have stories of this something in circulating in all of our families, right? So it's
Yeah.
that's the future that I think we have a real opportunity to flip things around by embracing early detection. So
Absolutely.
really, I see there's two areas where genetics and personalized medicine in particular are going to have a transformative impact. It's on that early detection and prevention. And then right on the other side of the spectrum, it's on hyper personalized and transformative therapies for rare diseases and genetic forms of of more common diseases that we've been talking about today, and everything in between. So I think those are I think the future is bright. We have a lot of work to get there, certainly, but
Yeah.
we're well on our way.
Do you think that that as horrible as COVID is and has been, let's stipulate that, but
Yeah.
now with this fast tracked vaccine, for instance, do you feel like that's going to have a good impact on moving, as you referenced, it usually takes like 15 years for these things to come to market or the life cycle and
That's right.
that sort of thing. And there's so many issues along that path that we could go down, but we won't. But do you feel like this is potentially going to make a difference in that?
I do, and I think you put it exactly right. It's of course a tragedy on a global scale, but the degree to which the vaccine developers have come together in under a year to produce a new medicine, I think one of the things that I really hope will stick is I think we've collectively realized that there's a lot of red tape that exists and time wasting that doesn't need to exist, and when a crisis shows up, we remove it. And I think as an industry, we need to resist putting all of those pieces back into place when this is all over. And there's obviously a fine balance. Safety is essential in these clinical trials,
Certainly.
and a lot of the red tape exists because it needs to exist, but it's figuring out what actually needs to exist. And the Moderna and BioNTech Pfizer trials were done exceptionally well from a safety standpoint. They didn't compromise on that point, and I think it's important to stress that they didn't compromise on safety, and were able to get it done in less than a
Right.
year. So I'm absolutely optimistic that we'll make some lemonade out of this
Good.
18 months of lemons.
Yes. And also, from my perspective, a lesson aside from get rid of that red tape that's unnecessary is collaborate, right? Like
Absolutely.
collaborate. So I've done some fundraising for MS and for pediatric brain cancer, and I was shocked to learn. And I think this has changed over the years now. It's getting much better than it originally was, but that a lot of research gets slowed down or maybe stopped because of the money, the funding, and researchers, there being a finite amount of funding available, right? And it kept shrinking. And so I always think of it in terms of, somebody in Switzerland might have a puzzle piece that fits together with something research over in Washington, but they're having to hoard their research because they are against each other in the funding of
That's right.
getting funding. And so some companies that I've worked with have taken that out and said, like, Race to Erase MS was the first company that I worked with that this just made so much sense. And they said, we've got you. We're going to gather a consortium of researchers, and you don't have to worry about funding. We've got that. That's our component that we're going to sort of donate to this collaboration. But we want your big thinky brains working
Yes.
on nothing but this. But you have to sign this that says, every 4 weeks, we're going to all get together. We're going to share everything, whatever. There's
We're
going to
going to
be
work together.
transparency. We're going to work together and collaborate. And my God, the leaps and bounds, particularly in pediatric brain cancer, were incredible. And from the time that they started with this model. So it feels to me like, we're standing on the precipice of some really good stuff, born out of a very unfortunate situation with COVID. But
Yes.
gosh, if something good can come out of it, woohoo.
Absolutely.
Right?
Yeah, absolutely. I think another point that has patient centricity has been a buzzword in research for a long time. I think you and I read a similar article that last time we talked about this, but
Yeah.
the idea that things like testing should be at home and convenient, and I shouldn't, I all of these elements that people have been talking about for decades has now been forced to happen because of the pandemic. And
Right.
I hope and I'm optimistic that a lot of these things will stick, but it's a little bit frustrating that people have been saying for years, like, hey, we can do this much more easily and simply at home. And it's more cost effective. It's less of a burden on the participants who are taking part. It seems like it ticks all the boxes, but inertia just prevents things from ever
Right.
changing.
Right. Somebody maybe needs to write an article about how COVID has the impact of COVID on advancing research.
Yes.
For all the reasons we just talked about, and I'm confident there are others as well. But if you got to look, I'm always looking for the silver lining. So that seems like one
Absolutely.
for sure. So if people are interested in learning more or would like to go ahead and sign up, where do they do that? Is that just
So
sano.com?
they can, if they go to sanogenetics.com,
Okay.
that's our main website. Sanogenetics.com/MS is the section of the site that's totally focused on MS. If they want to follow us on social media, we are Sano Genetics on Twitter, Instagram, LinkedIn. We're pretty social as a company, so feel free to send our team a message there.
And what is your podcast?
Great. Our podcast is called the Genetics Podcast. So easy to search and find. So we're about 2 years in, 55 episodes. The most recent one was with Caroline Craven, who's the girl with MS.
The girl with MS. We love her. She's been on this podcast
great.
Several times. We adore
She's amazing.
Caroline.
Yeah, previous
she really
episode
is.
with Barry Singer. It's a genetics focused podcast. So we have a lot of patient advocates, researchers, people that are starting interesting companies in genetics. It's a lot of fun to do. I really enjoy it. And I get to meet a lot of great, interesting people.
Yeah. And just FYI to everyone listening that all of these clickable links will be in the show notes. So you don't drive off the road trying to write this down or something. We got you. We'll take the notes for you.
Public service announcement.
Yeah, right. Maybe I should have said that earlier, but whatever. So thanks so much for being here, Patrick. I really appreciate it. It's been such a joy to get to know you and for you to educate us all. And for me to get my DNA profile was really interesting. And I just love that I am helping, I spit in a vial. It took nothing and I'm helping research. That's huge. I can feel good about that. Thanks for all that you're doing to further MS research. I hope you'll come back and update us on how that's all going sometime soon.
I would love to. Thank you so much for all your feedback and kind words on the process. We're really excited to hear from other people and continue to improve this and bring research forward. And I'd love to come back in the future. I think you're doing some amazing work both with the podcast, and I know you've got a couple new things that you're working on. I'm not sure if you've announced them yet or not, so I won't I won't announce them here for you. But
thank you. I appreciate that he's referring to patients getting paid, and I haven't announced that, but
okay, perfect.
Yeah, but thank you. I appreciate that. I appreciate your thoughtfulness, and thanks again for everything. And I look forward to the next time we chat.
Absolutely. Thanks, Kathy.
Take care.
Quick shout out to Steve Woodward at podcastingeditor.com for the fantastic work on this podcast, including editing, show notes, and ingenious ideas. If you'd like help with your podcast, whether you're just starting out or an old pro, visit podcastingeditor.com and tell Steve I sent you. Thanks, everybody. I really appreciate you listening to the FUMS podcast show. Be sure to subscribe to it so you won't miss an episode. You can do that right on the website at FUMSnow.com. While you're there, Sign up for the free email list so you'll be among the first to know of any new findings in MS research, new therapies and products, as well as any blog posts and podcast episodes I release. Want to chat with others in the FUMS community? Join us on Facebook at FUMS Now. Thanks again, and don't forget to talk to the stupid disease as it deserves. Tell it FUMS every day.